So I'm giving a report today for an 83-year-old female who presented to the emergency department following a wellness exam with her PCP. So she was at her doctor's office, and when they took her vitals, her heart rate was at like 20s and 30s, so bradycardic. And she came in with her caretaker following that, but has no change in her level of conscience or her mentation. She's very alert and oriented to self, situation, time. She's predominantly Japanese and Korean speaking, can answer a few questions in English, but the majority of it has to be directed to either her sister or we had a Japanese speaking doctor come in to help translate, as well as to call her son, who is her advanced care directive and her proxy. He lives in Seattle, so there's a bit of a time difference there. But going back to the patient, she's asymptomatic with a steady gait, and she actually preferred to ambulate around the unit with a cane, goes to the bathroom on her own. Vitals for us have been pretty steady. Her blood pressure is 133/44. Her respiratory rate is 22, and her temperature is 36.4. Her heart rate for us ranged between 26 at the lowest to 35. She has a 20 gauge in her left forearm, which when she initially came in, we started a 500 milliliter bolus. Upon getting her labs back, we saw that her BNP was 1,786. However, there's no evidence of fluid overload. Her lungs are clear to auscultation. Her edema, if any, there's like trace edema in her lower extremities, 1+. Her peripheral pulses are strong. Her radial pulse is also strong. No JVD. Her cap refill is fine, despite the low heart rate. So her EKG that we took showed sinus brady, and so we ended up putting the Zoll pacer pads on her, just in case we needed to pace her. But aside from that, her labs were out of whack. So when we were reviewing them, we saw that her potassium was 5.7 and the sodium was 130. So for this, we administered calcium gluconate. We gave 1 gram IV PV, and her magnesium was also 2.4. So that hopefully took care of that. And we gave her 40 milligrams of Lasix because of her elevated BNP. Her BNP was 1,786. We also started a liter of lactated ringers. Her BUN was elevated. It was at 40. Her creatinine was at 2.0. Her GFR is 25, so there's evidence of kidney damage with that. Her platelet count was in the 150s. So that's her. Her labs are out of whack, so we tried to do what we could. So what we did, we gave her, as I said before, we gave her the 40 milligrams of Lasix. We gave her the 1 gram of the calcium gluconate, and then we gave her the 1 liter of lactated ringers. And yeah, the doctor that was the primary translator spoke to the son updated her on her condition and that she was going to be admitted to the hospital. So she's being transferred to PCU later on tonight. Any questions? Okay, great.